Hello, this is a presentation on bronchitis from Victoria, Anthony, Heather, Miranda, and Marisol. Bronchitis is a self-limiting inflammation of the bronchi in the lower respiratory tract. There is inflammation in the mononuclear cell in the airway walls, and there is an increase in neutrophils that crowd into the airway lumen. This causes more inflammation and oversecretions of mucus. The most common cause of bronchitis is viruses, but other causes that can cause bronchitis are air pollution, dust, inhalation of chemicals, smoking, chronic sinusitis, and also asthma.
Subjective and objective clinical manifestations. Clinical manifestations of bronchitis include cough, which is the most common symptom and can usually last up to 3 weeks, mucoid secretions, which could be either clear or purulent. Often it's believed that if the patient has green sputum that they're suffering from a bacterial infection, but this isn't always a reliable indicator. Other signs of bronchitis would be headache, fever, sore throat, malaise, hoarseness, myalgias, dyspnea, and chest pain. A diagnosis is based on a clinical assessment. An assessment of the lungs may reveal normal breath sounds or crackles or even wheezes, usually on expiration and with exertion. Consolidation is always absent in bronchitis, and if it's heard, it's usually suggestive of pneumonia. This is the only time that a chest x-ray is necessary because bronchitis would show a normal chest x-ray. So if pneumonia is suspected, then the provider normally would order a chest x-ray to rule it out.
The diagnostic tests of bronchitis are mainly based on the clinical assessment findings. They consist of lung sounds, the presence of consolidation, a sputum culture, and as well as an x-ray. Lung sounds may reveal crackles or wheezing. The presence of consolidation is used to rule out pneumonia, and with patients with bronchitis, consolidation would be absent, which means that fluid will not be accumulating in the patient's lungs. A sputum culture is performed to see what kind of bacteria is causing the bronchitis, and the collection of the sputum is usually an off-white, yellow, or greenish color. A chest x-ray is also used to rule out pneumonia, and the findings for a patient with bronchitis would be normal.
Some common medications that is used to treat bronchitis are bronchodilators, albuterol or ipratropium, corticosteroids, and antibiotics. Bronchodilators can be used with an inhaler, and this will help open airways and decrease wheezing. Albuterol and ipratropium are usually used together in a nebulizer treatment. Corticosteroids are prescribed to decrease the inflammation in the airways. And sometimes it is necessary to use antibiotics if a doctor suspects an infection. So some common treatments for bronchitis is going to be oxygen therapy, humidification and nebulization, breathing retraining, and airway clearance techniques. Oxygen therapy methods, there's different methods that you could use. There's a low flow delivery devices such as the nasal cannula or a simple face mask. You could also use high flow delivery devices such as a Venturi mask or a high flow nasal cannula. Humidification and nebulization, this helps in decreasing the irritating effect on mucous membranes that dry oxygen has. Breathing retraining. Breathing retraining, we use pursed lip breathing, which prolongs exhalation and prevents air trapping, as well as diaphragmic breathing, also known as abdominal breathing, aids in achieving max inhalation and slows respiratory rate. Some airway clearance techniques that are used are effective coughing and chest physiotherapy. Chest physiotherapy consists of post-dural drainage, percussion, and vibration. And lastly, some airway clearance devices can help with airway clearance.
So several nursing diagnoses can be deduced from the disease bronchitis, and I will be discussing just several possible nursing diagnoses that nurses tend to treat and try to intervene and correct these issues. The first one being ineffective airway clearance, which is basically the inability to clear secretions or obstructions like mucus from the respiratory tract to maintain a clear and breathable airway. This is related to the excessive thickened mucus secretion, and it can just be again related to the disease process. Possible evidence that you could hear during to, distinguish this type of diagnosis is diminished or absent breath sounds once you auscultate the lungs. You can also hear crackles and wheezing. There's also sometimes changes in rate and depth of the respirations, increased mucus or nasal discharge, and even fevers are related to this as well. It kind of has to go hand in hand with everything. So typically the desired outcome that you would want is just demonstrate effective coughing mechanisms independently and make sure that there are clear breath sounds whenever you auscultate the posterior and anterior lung sites. You're going to want to go ahead and assess airway for patency, assess respirations, again, assess breath sounds and the cough. Just kind of make sure that the patient is comfortable. The next nursing diagnosis would be an ineffective breathing pattern, which is basically inspiration or even expiration that does not provide adequate types of ventilation, meaning that oxygen isn't being supplied as much as it's being demanded. So this could be related to an increased work of breathing, again, the inflammatory process of the disease, and it could even be some tracheobronchial obstruction. Possible evidence could be persistent cough, nasal flaring. It could be dyspnea or tachypnea, shallow respiratory excursions, and then you could have abnormal arterial blood gases as well. Desired outcomes that you would want to have is just, again, effective breathing patterns and just kind of a more relaxed state of the patient. Again, you're going to want to assess the respiratory status. You're going to want to just palpate the chest and auscultate for the breath sounds. You're going to want to note any level of changes in consciousness, assess the pulse rate, monitor, again, the ABGs. That's really important. The next nursing diagnosis is going to be deficient knowledge, and that is basically just a lack of information about the respiratory virus, which is very common, and it is basically just kind of, a lack thereof knowledge towards the specific topic at hand. So any type of, when a patient will verbalize like a lack of understanding about the disease process, or in some instances if children or their parents will verbalize that they don't really understand what is causing this to come about. So once that kind of happens, it's kind of the nurse's responsibility to kind of assess the existing knowledge of the disease, how basically prevention, transmission, and treatment. And you're going to kind of that provides a baseline for the nurse so that they can, again, educate their patients. You're going to want to teach about the virus and teach about the signs and symptoms of any respiratory distress and infection, including fever, dyspnea, just kind of types of potential spreads for the virus. And you're going to want to go ahead and make sure that you're going to teach good hand washing techniques and encourage parents to provide good nutrition and hydration, and emphasize that you want to have increased fluids because this could also just lead to several potential complications. So again, there are several other nursing diagnoses, but I felt that these were some of the most important ones to understand. Again, you don't necessarily, deficient knowledge could not necessarily be the case. In some instances, it could sprout anxiety, which is a vague, uneasy feeling just because of the diagnosis of the disease. And then you're going to want to also take into consideration fatigue, because they could have a decreased capacity for physical or mental work at, compared to a normalized level, based on the lack of respiratory effort or lack thereof of a respiratory effort related to the disease. So those are just things to keep in mind.
One of the potential complications of bronchitis is pneumonia. It's more likely to occur when the defense mechanisms become incompetent or overwhelmed by the virulence or quantity of infectious agents like in viral bronchitis. Some ways to prevent this from happening is to get the pneumococcal vaccine, get prompt antibiotic therapy when it's needed, and to mobilize your patient. Getting them to move will help open up those airways and move some of the fluid around. Some of the signs and symptoms that can be seen with pneumonia are sharp pains in the chest, chills, fever, fatigue, shortness of breath, wheezing, coughing, and fast heart rate. Another potential complication of bronchitis is atelectasis, which are collapsed airless alveoli of one or part of one lobe that could occur. Some ways to prevent this from happening is deep breathing and coughing. Signs and symptoms of atelectasis is coughing, shortness of breath, shallow breathing, low oxygen, and fever. And if you see these signs and symptoms, make sure to let your doctor know. A pneumothorax could also be a potential complication with bronchitis. Air collects in the pleural space, which causes the lung to collapse from the pressure of the inflammation. Ways to prevent this could be oxygen therapy, corticosteroids, bronchodilators, and mucolytics. This can help open the airways, clear mucus, and decrease the inflammation, which in turn decreases the pressure in the pleural space. Signs and symptoms of this could be pain in the chest pressure, coughing, high heart rate, shortness of breath, shallow breathing, and low oxygen saturation.